is nothing more natural than giving birth. But often things go wrong for both the mother and the child during that long journey from the womb to the world. A huge number of them lose out to complications during pregnancy and childbirth, mostly from preventable causes. Anemia, hemorrhage, sepsis, hypertension, or obstructed delivery is often the killer. The tragic reality is that these lives could be saved if timely help could reach them. But if you live in a remote area, or if you're a poor woman, such help is hard to come by. Even if you get some help, it is often too late.
My baby had stopped feeding, and it was too late by the time I took her to the hospital. There was nobody to tell me that something was not right with my child.
Women take care of their health most when their health can affect future generations. Women really want to make sure their babies are well and take every precaution when possible, from modifying nutrition to adjusting their lifestyles, even changing their work environment. But imagine being pregnant and alone, turned away from receiving care because you don't have the money, or having your healthy newborn die in your arms because there was no one to teach you simple life-saving techniques.
If we are to reduce maternal and infant mortality in this country, we should give equal emphasis to what happens before birth and after birth. A comprehensive system for antenatal care and a very strong public health system for postnatal follow-up for the mother and the baby are equally important, if not more, than the intranatal period when the actual birthing is taking place. This is where we have missed out steps, strong steps for following up the mother throughout her pregnancy and following up the mother and the baby throughout the infancy.
Maternal mortality is not a disease. It is preventable. And yet, women are dying. Their ability to survive something like childbirth is deeply linked to poverty, malnutrition, and the absence of basic health care.
This is my grandchild. We lost her mother to severe bleeding after a few weeks of her delivery. We didn't know what was happening to her, and there was none to help us.
The missing link between life and death is a dedicated maternal healthcare system, which is both sensitive and accessible to all. In 2007, the Indian government launched Janani Suraksha Yojana with a huge network of community health activists called Ashas to promote maternal health through institutional delivery. While it succeeded in bringing high volumes of birthing women to the hospitals, shortage of skilled birth attendants, inadequate infrastructure and medicines have not helped much in saving lives. India still records one of the highest number of infant and maternal deaths in the world. Almost 1/3 of all stillbirths, newborn and maternal deaths across the globe take place here in India. The maternal health crisis in India may be a complex issue, involving a range of social and economic factors. The low status of women, lack of education and awareness, to a lack of infrastructure, hospitals, trained birthing staff, and an effective maternal healthcare system. There is, however, one thing that can make a huge difference: providing skilled, supportive and preventive care to all women and infants, starting at the community and seamlessly moving up to the specialty hospitals through a dedicated network of professional midwives.
85% of pregnancies are usually uncomplicated and are otherwise known as low-risk pregnancies. Professional midwives are trained to take care of normality, and therefore, if we have midwives in the community, they could take care of 85 to 90% of our women during their pregnancies, labor, and delivery.
For mothers living on the fringes of poverty and deprivation, midwives can indeed become the key to good health and survival. Regular monitoring, timely treatment, and early diagnosis of high-risk pregnancies can indeed be a big lifesaver for them.
Midwife-based models of maternal care have shown across the world to be effective, safe, and comfortable and low cost. Even in India, where we tried out midwife model of care in different states, we found that the comfort level of the mothers is increasing as midwives gain confidence.
When institutional care is not easy to access or lacking, it is all the more crucial to have health workers rooted in the community. Countries that have a dedicated midwifery workforce are able to provide almost 90% of the essential care for women and newborns at their doorsteps. Being the first-level caregivers, midwives can avert most complications. A skilled midwife is fully equipped to recognize a potential danger early on and refer the mother or the child for specialized care in case of an emergency. Her abiding personal connect with the patient can help eliminate unnecessary interventions, multiple referrals, and delays in life-saving measures, and in the process, save them from the many indignities and medical abuse they suffer.
If you really wish to provide a better maternal health care service and avoid unnecessary deaths, we don't need high-tech equipment, we don't need huge hospitals, but all we need is to invest in a strong midwifery cadre that goes across the length and breadth of this country.
Given the brute reality of scarce resources, distance, and the economic divide, with modest investment in basic training, supervision, and support, they can promote and deliver proven health interventions that can save the lives of thousands of mothers and children each year. It is time now to promote a woman-centered, more natural, and less invasive care. A midwifery model of care covering the entire continuum, from the community up to the specialized hospital. Midwives can indeed change the face of maternal and newborn care in India. Our effort is to promote a midwifery-based maternal healthcare provision in the country that gives every mother and her baby a healthy chance at life.